Good afternoon, everyone. Thank you for joining us on what to do with your fertility treatment during this pandemic. Are we still open during MCO? Well, yes, we are, and I would like to reassure you that actually we haven't stopped operations throughout this MCO, so we have remained open since March. And what shall we do during this pandemic? Well, unfortunately, this is the new normal now, and life does go on. So our SSCD remains open. Please call us for an appointment because we also don't like to crowd the area too much, and this is part of helping us to keep everyone safe. So normal rules do apply. We do ask you to fill out a travel declaration form so that we can keep our staff and yourself safe. When you arrive, we will ask you to sanitize your hands, and we will also ask you to social distance yourself while waiting for your appointment. A temperature will be taken, and rest assured, even I have to fill in a form to declare that I haven't been in contact, I don't have symptoms, and we are very, very aware that this pandemic means that COVID-19 is out there now and it can affect everyone. So everyone, please keep safe. So now the main question that most of my patients ask me is that, is it safe to start fertility treatment now in this kind of conditions, and they are worried. Well, it does look like we are going to have to live with COVID-19, and it's not going to go away anytime soon. So although in the beginning of the pandemic, most of the fertility societies that govern us have recommended that we stop fertility treatments. But now, since the pandemic seems to be going on and on, we have taken the stance that it should continue. Why? Because more and more fertility is no longer a luxury. Fertility treatments are not a luxury. They should be viewed as a form of treatment, as a form of something that needs to be done. Okay, there are people who cannot wait for fertility treatment because, as we know, as we get older, fertility treatment success does drop. Okay, so I would encourage anyone not to delay getting pregnant or seeking fertility treatment because of this pandemic. So the pandemic is here to stay, and this is what we have to accept. Okay, so we just have to be extra vigilant and extra careful that we are safe. So how do we ensure that we are safe in offering fertility treatments during this pandemic? So we sometimes encourage patients to maybe take a COVID screening test prior to starting their fertility treatment. And some of them, and some of our patients actually have taken that up. So they ensure that they have no COVID before we start the injections or the stimulation, to ensure that, because unfortunately, if you do test positive for COVID-19 in the process of your treatment, we do have to cancel your treatment. This is just to keep everyone safe. Okay, so during the course of the treatments, we encourage you to avoid crowds. Don't go for like family gatherings, for parties, for lunches. I know it's very tempting because all of us have been cooped up for a really long time now. But if during this pandemic, if you are going for any treatments, not just fertility treatments, just keep safe and maybe just pseudo quarantine yourself even. Okay, so and just before 48 hours before you come in for any procedure in Sunway, we will ask you to do a COVID-19 test. Most of the time, I'm very happy to say it is complimentary, and Sunway is footing the bill, but that's conditions do apply. Okay, so maybe if you'd like to call our care line, then we can explain this further to you. Yvonne has just asked a question, will postponing my treatment affect my chance to have a child? Well, it depends on how old you are. So we do know that in normal physiological changes to a woman's body, as we age, our chances of getting pregnant does drop. Okay, and this drop is seen a little bit at 32. There's a big drop at 37, and then again at 40. So if you're approaching these ages, yes, postponing your treatment will affect the outcome of your treatments. So this is why we are the fertility now is saying, no, please don't wait. Please take your fertility treatment seriously and carry on. Okay. So the other safety measures that we do take place, like I've mentioned, even staff are being asked to do self-declaration, and if we suspect that there has been contact or if anyone displays any symptoms, they are immediately tested and quarantined. So in that way, we are aiming to keep everyone safe. Okay. All right, Nurul has asked, how do we know which is the suitable fertility treatment for us? Well, it's very difficult to say just because I haven't met you before, Nurul. But when you come to see a fertility specialist, we will sit down and we will assess, we will listen to your story, we will assess the situation, and then from there we can offer a tailor-made treatment program for you. So often I will ask my couples to actually go home and discuss how fast, how quick, and how far you're willing to go to conceive. So because of that, then I can't tell you, oh, this is the blanket rule for everyone. It's not. So it is tailor-made, and I will encourage you to come in for an examination and a chat with us first. Ayong Kim says, when will I know it is safe to seek fertility treatment? Well, I would like to reassure you that it is safe now to seek fertility treatment, because we are taking this pandemic very seriously, and we also do take the appropriate steps to keep everyone safe. So please don't delay your treatment. But of course, if you are uncomfortable, you can wait for the numbers to drop a little bit. Hopefully with this MCO, we will see the number of new cases dropping. But I'm telling you that the pandemic is here to stay. So it just depends on how comfortable you are coming to see us. Yenwai has asked, my sister is married 2 years but haven't gotten pregnant. Are they advised to have IVF? Well, maybe not necessarily IVF. There are other steps and other forms of treatment before we actually jump into IVF. So, you know, as simple as maybe you come in at the correct time of the month. If you have regular periods, we look at, you know, whether your egg is developing and whether it's correct time to have sex. We will assess to see if there's any problems, if there's anything that we can do to enhance your fertility rather than just jumping straight for IVF. So why don't you just ask your sister to maybe call our care line and come in before we will say IVF or not. Just come in for an assessment. Can I start fertility treatment if I am on day 1 of period? Well, we actually do start fertility treatment when you are having your period. So usually our patients are asked to come in for an assessment prior to that. And once we have assessed you and decided how we are going to start your fertility journey with us, then we ask you to inform us on the first day of your period so that we can go accordingly after that. Okay. My sister is pregnant now. Is she at risk of COVID-19? Okay, all of us are at risk of COVID-19. So what I tell my pregnant patients is this. We know that when you're pregnant, your immunity is altered. So our immune system is a little bit different. Some women tend to catch colds more often. We tend to get diarrhea and food poisoning more often. So I would say that if you are pregnant, then you may be more likely to get the disease, and you may be more likely to get a more severe form of the disease if you were to contract COVID-19. Now, in the world, it hasn't been shown to have such, and it hasn't been shown to actually affect miscarriage rates or prematurity rates, but it's still very, very early days for us to judge what COVID-19 will do to pregnancy. But so far, it doesn't look like there's any different. So I advise my pregnant patients not to go to crowded places, put your mask on at all times, be savvy about hand sanitization. Don't wear the mask and do this to your face all the time, because then you're transmitting the virus that might be on your hands into your face. So just be sensible. Don't go to crowded places. That's about it. Okay. Christine asks if it's safe to take the COVID-19 vaccine if you're currently or planning to have fertility treatment. Well, the COVID-19 vaccine is not available in Malaysia yet. We hope that it will be available by the end of February. That's what we've been told, but we are not sure. and the vaccine is of limited stock. So they have, the government is planning how to distribute the vaccine. I would say we don't know how safe the COVID-19 vaccine is, but someone has told me something very interesting. So I was very skeptical about taking the vaccine. I was like, oh, maybe it's rush, maybe it's this, that. But the coronavirus, this is not the first time that we have a problem with the coronavirus. SARS is also a coronavirus. And so they have been studying this virus and the potential vaccines for a really long time. So someone said this to me. She said, look, we are in a burning house at the moment. So you're in a burning house with COVID, okay, and the fire is COVID, right? And then your house is burning, this is the world. So the fireman is down there with a trampoline to say, jump. Will you jump? I think I would. So in that case, then I think I would take the vaccine. So would you take the COVID-19 vaccine? I would. I'd rather take the COVID-19 vaccine before I get pregnant than if I'm pregnant. So that's the answer for you, Christine. The other thing that I would also like to highlight is actually our care line. So if you want to reach out to us to ask whether or not it's safe, whether or not you should be coming forward for fertility treatment, how to go about starting your fertility journey, then I would encourage you to actually call our care line. Now, when you call our care line, it is held by one of our liaison people. So one of I actually call her my fertility coordinator, okay? And they will be able to advise and help you how best to approach us and whether or not you need to come to us now, what do you need to do before, and so things like that. And that's very important, actually. So our care line is open. If you can just communicate with them during office hours, that'd be great. They are available 24/7, but they are humans too. So if you can maybe not call them like in the middle of night, 3 a.m., that'll be great. Okay, so thank you very much. Bunyong Ng has asked again, when will I know if it's safe to seek fertility treatment? I would like to say that it's safe now, okay? And we are taking steps to ensure that everyone is safe. So yeah, come forward and have your fertility treatment. Otherwise, please call our care line and hopefully we can address your fears and try to allay them. And she's also asking, are the eggs, sperm and embryos going to be safe during the pandemic? You mean to say when they are out of your body? When they are in your body, if you are not actually having COVID-19, then they would be safe as it can be, all right? COVID-19 has not been shown to affect fertility. It has not been shown to be bad for embryos or for pregnancies. So we can extrapolate from this kind of observational data that we have to say that I don't think that they will be adversely affected. So again, in our center, you will be tested for COVID-19 before we allow you to collect your eggs or undergo any general anesthesia. Okay, what else can you do to ensure that you're safe before you embark on pregnancy or fertility treatments? Again, I would like to say things like avoid crowds, take supplements to boost your immunity. You can try vitamin C, vitamin B. Hand sanitization is very, very important. And of course, if you have any questions, you can always call our care line. And this is our care line. You can also, oh, it's upside down, never mind. But you can also go to our website or our Facebook page and connect with us there. Okay, so I know this is very short. I'm just wondering if there's any of you out there who has any other questions. Please don't hesitate to call us, and keep safe. Come forward. Fertility treatment is not a luxury, it is a necessity, and it's safe to have fertility treatment now. Okay, see you again soon. Bye-bye.